afternoon, everyone. I'm Brett Perlman, President and CEO of the Center for Houston's Future, and welcome to today's webcast on immigration and essential workers in the time of COVID-19. As many of you know, the Center is a nonprofit, and we were established in the year 2000, so this year is our 20th anniversary. We're working to convene business, government, and community leaders in fact-based strategic planning and collaboration on issues of greatest importance to the Houston region. We're currently focused on three major issues: the energy transition, healthcare, and immigration, as well as our Business and Civic Leadership Forum. Be on the lookout for announcements about events this fall on energy transition and healthcare, and check out our website for information about our Fall Leadership Forum. In our immigration work, we've been looking at the economic impact of immigration on our city and region, and last year we published a study, Houston's Economic Future, Immigration, which is available on our website. We've been working in collaboration with the Baker Institute's Center for Mexico and the United States and Rational Middle Media in our research and producing a video series on immigration and in a series of community conversations on immigration issues. Today's webcast continues these conversations, and we're fortunate to have a really great panel of experts and scholars from around the country to discuss this topic with us. We'll kick off today's discussion with a brief video from Rational Middle entitled "Protecting American Jobs," followed by our conversation. Thanks for joining us.
A lot of people opposed to immigration in the United States argue that immigrants are taking American jobs, that they're lowering American wages.
Immigration, we're either a country or we're not. We either have borders or we don't. We either have borders or we don't. You better be smart and you better be tough, and they're taking your jobs, and you better be careful.
Immigrants taking American jobs is perhaps the most basic concern.
There's really two portions to this argument, I think. One is that the labor market is relatively fixed. That is, there really aren't too many new jobs created on net, so therefore more immigrants coming in and maybe working those jobs denies native-born Americans the opportunities to work them, pushes natives into unemployment. The second argument is that immigrants come in, this increases the supply of workers, and as a result, the wages go down, and thus makes Americans worse off.
We're basically, in this debate, talking about large-scale undocumented immigrants.
The presumption there is that they're taking away a job that I really want to do, and that immigrant, whether Salvadorian, Mexican, Haitian, is coming here to do.
They actually do the low skill level, as I would call it, a lot of farming, a lot of agriculture work, construction work, service work, housekeeping, maintenance jobs.
Those are jobs that have been done by immigrants throughout our history. Italian immigrants built the skyscrapers and the subway tunnels of New York. Chinese immigrants and Irish immigrants built the railroads. We have an agricultural industry because of immigrants. Without that, we would be dependent upon importing all of our foodstuff, and that would be a national security issue.
We know of fields that have been raided by ICE, and all the workers have been picked off. You would expect U.S. citizens and permanent residents to line up and say, these are the jobs we couldn't get. We're actually waiting for those jobs to vacate so that we could actually get them. There isn't a line out there of American citizens willing to do that kind of backbreaking work. Walk around in that field, bent over all day under the sun for $7, $8 an hour. No one is lining up.
So on the displacement argument, which is the argument that immigrants are taking jobs specifically from natives and pushing them into unemployment, there's almost no academic research that finds that that is the case. What we do find is that by having more immigrants in the U.S., it increases the supply side of the economy, which means there's more people working, making things, but it also increases the demand side, which means there's more people buying things, which also increases demand for the production and products made by workers, which increases salaries and jobs. That money goes to employ Americans. So if you take out that consumer, then you're destroying job opportunities elsewhere, even though you might free up, that person's specific exact job for an American.
If you think about the fact that the economy of a country grows only on the basis of its population growth and on the basis of its productivity growth, then immigrants add population, and therefore they add economic activity, and therefore they add economic growth. That has to also be considered in light of the fact that the United States population itself is aging very rapidly. If you segment the population of the country, you realize very quickly that the population is well under replacement level.
Without immigration at our current fertility rate, we would be in an aging and declining population situation, and we're already seeing that in certain other parts of the world.
We have instances in Europe of countries that are dying out, from Italy to Austria to Germany itself, that is trying to attract migrants because they realize that a vibrant, young, productive population is important.
Japan, which is a notoriously closed society to immigration, is finally opening up because they're literally dying and getting so old that they cannot fill the jobs they have. Even China, because of its one-child policy, is now facing a population that is increasingly old with too few new workers coming in. Russia is in a similar situation. So it's really our history of immigration that has prevented us from being in some similar situations. We have a lot of dependencies on our workforce. Our social security systems, our Medicare systems are pay-as-you-go, not you get what you paid. So everybody who's working now is paying for everybody who's getting benefits now. And if there's not enough people working when I retire, then I'm not likely to get any benefits. For that reason alone, we need to keep having a growing workforce to support a growing retirement community.
This is a point that is often missed in the immigration debate. Immigrants, even if they're lower skilled, are contributing to the economy and are having children and are adding to the growth of the overall economy.
Now, in terms of the wage effect on this, one study by George Borjas of Harvard University does find negative effects on the wages of native-born Americans, but only on those who are high school dropouts. And it shows that their wages fell by about 1.7% relative to other workers over a 20-year period, while the wages of other Americans actually increased by about 1%. And that's the most negative finding in the entire academic peer-reviewed literature.
We do have American young people, but simply not in the numbers that are sufficient to meet the demand of U.S. industry. I mean, we need these workers today. We need American-born workers and foreign-born workers working together to create products, opportunities across the economy.
We have to really look at where these jobs are coming from, who is applying, and how we can encourage more U.S. citizens. And part of that has to do with looking at our K through 12 system. I think the solution will be not only to educate people, but to set up a system that's flexible enough to move with the needs of our country.
The American economy demands workers at every single skill level. And the U.S. government is just not very good at selecting how many immigrants from each skill level should be allowed into the United States at any given time. And there really is no way for the vast majority of these folks to immigrate legally to the United States to work currently.
The fact of the matter is Congress has punted this issue for so long that the ripple effects of them not having dealt with it are being felt at every layer of our government and every community across the country. If we continue to not deal with this fundamental issue of who are we as a country, who else do we want to invite to join us, how do we ensure that the majority are doing it legally, how do we deal with the fact that we have allowed, for good or ill, 11 million people to become Americans in every way but papers, and can we do without on a humane and rational level? The fact that the politics have allowed our politicians to get away with this for 3 decades is the problem. We need to hold them accountable and say, come up with something and pass it. But, to say we can't get the perfect, so we're not going to do anything is not the way to run a country.
Hello, and thank you for joining us. I'm Stephen Scarborough, Manager of Strategic Initiatives at Center for Houston's Future. Immigrant workers, both documented and undocumented, are critical to our workforce, both nationally and especially here in the Houston region. The ongoing coronavirus pandemic has only underlined how much we rely on these workers for essential services. From agriculture and meatpacking to food distribution to grocery retail to healthcare and beyond, we are highly reliant on immigrant labor. In the Houston region alone, just over a quarter of our workers are immigrants, but half of our doctors and surgeons are foreign-born, and the percentage of medical scientists here, the people working tirelessly to develop things like a coronavirus vaccine who are immigrants, stands at about 70%. Today we're going to explore questions like, what are the facts about the numbers on immigrant essential workers? In the times of COVID-19, how do we value these workers and secure their safety? And what's the effect of current restrictive immigration policy on these essential workers? We've put together a great group of expert panelists today from across the country. Joining us are David Bier, Immigration Policy Analyst at the Cato Institute, Guadalupe Correa-Cabrera, Associate Professor of Government at George Mason University, and a non-resident scholar at the Baker Institute's Center for the United States and Mexico at Rice University. Julia Gelatt, Senior Policy Analyst at the Migration Policy Institute, and also Ken Janda, Principal at Wild Blue Health Solutions, as well as Adjunct Professor at University of Houston College of Medicine, as well as Rice University's Jones Business School. We're going to start off by having the panelists go around and give brief introductory comments. So David, why don't you kick us off by telling us a little bit about your organization and your perspective on this topic.
As was mentioned, my name is David Bier. I'm Immigration Policy Analyst at the Cato Institute.
I'm sorry, David, would you turn on your video, please? Oh, never mind, we got it.
You got it, all right. For those who don't know, Cato is a public policy research organization in Washington, D.C. We're dedicated to individual liberty, free markets, limited government, and peace. I'm going to keep my remarks succinct, and I'm looking forward to a great discussion today. I'm going to focus on essential immigrant workers in high-skilled positions, and I have a few slides to illustrate the scale of what we're talking about here. The first slide shows the share of foreign-born workers in various healthcare and medical occupations in 2018 in the entire United States compared to the foreign-born share of the U.S. population overall in orange. It goes without saying that these jobs serve an important role during the pandemic. As the graph shows, foreign-born workers were almost 14% of the U.S. population, but were significantly more represented among occupations. These occupations, including healthcare techs, registered nurses, medical assistants. Immigrants were 1 in 5 clinical lab techs, surgeons, diagnosing practitioners, and nursing assistants. There were 1 in 4 physicians and 1 in 3 home health aides, who, as we know, are very important for the elderly who have been so harmed by this pandemic. This next slide focuses on medical and scientific research that could be useful to make cures and vaccines for COVID-19. Again, immigrants are disproportionately represented in these fields. They're 40% of all medical and life scientists in this country. They're 1 in 3 chemists, 1 in 4 biomedical engineers. Immigrants' contributions to science were very significant even before this crisis and only become more important now. This next slide highlights the importance of the H-1B program for high-skilled workers in particular by focusing on H-1B approvals for companies leading the search for a cure or vaccine. From 2010 to 2020, these companies received more than 11,000 H-1B approvals, including many for biochemists who are critical for this type of medical research. These companies include Moderna Therapeutics, which is farthest along in developing a vaccine for COVID-19. And as many of you may know, Moderna was in fact founded by an immigrant, an Armenian immigrant. I should mention that while not a pharmaceutical, an immigrant from Taiwan to the U.S. also invented the N95 mask, which has saved thousands of healthcare workers' lives in the United States. And while I don't have a slide for it, I did want to talk a little bit about the IT industry real quickly. About 1 in 4 workers in computer jobs in the United States were foreign-born in 2018. Important research by economist Adam Ozimek has shown that IT services have greatly increased the ease of the transition to remote work for millions of U.S. workers, saving millions of jobs over the last year. In the same vein, many Americans don't realize it, but Zoom, which we're currently using, was invented by an immigrant. And Zoom has played such an important role in this transition to remote work. The list of innovations invented by and businesses started by immigrants is lengthy. It includes half the Fortune 500 companies. But I'll just end by noting that this administration has shown absolutely no awareness of the importance of these contributions and has actively harmed high-skilled immigration to the United States. We are sabotaging ourselves for the next several decades by turning away these high-skilled innovators and contributors. So thank you, and I look forward to this conversation.
Thank you, David. Guadalupe, why don't you take us, continue us forward.
Thank you very much, Steve. Thank you for organizing this event. I'm very pleased to be here. Well, yes, I'm Guadalupe Correa-Cabrera. I will tell you a little bit about my work, the work that I have done connected to unauthorized, undocumented, irregular immigration. I would like to say that there are 2 main subjects that right now occupy the discussion, the center of the discussion in the United States. The migration that comes from the South and that wants to enter into the United States, that in the past couple of years have caused the different forces that have been involved in the discussion and the decision-making process, this so-called asylum crisis. People who come from Central America, from other parts of the world to the United States and want to arrive to the United States with the purpose of having a better lives or are escaping from violence or from war on different countries. I have been doing research about this subject specifically in the past 5 years. I have been in Guatemala, Honduras, and El Salvador, and I have travel throughout the migration routes arriving to the United States. This time, there's another very important subject, which is immigration, immigration in the United States, the people who are already here and are working. I am focused more on unauthorized immigration, irregular, undocumented immigration in the United States. I'm an immigrant myself in the United States. I had the opportunity to study and to work in this country and to study the problems of family members, relatives, and the people of my country and of other countries that I've been studying that have been able to enter to the United States and to work without authorization, but are working and are provided with jobs and are making America great. And it's very important that today, and I'm starting to develop a new project about essential workers, Hispanic essential workers in the United States in the context of the pandemic of COVID-19. What is happening today and what will happen in the near future. This study is going to be centered in the Washington, D.C. metropolitan area. It's very important because I live there and because of the importance, politically speaking, and because of the importance of Hispanic undocumented workers. And I'm going to be working in conjunction with the Institute for Immigration Research at George Mason University, and we're going to work hand in hand with some NGOs of the region, the Washington, D.C. metropolitan area. It's near to us, and we will be conducting a survey, and we'll be conducting semi-structured interviews to try to understand and try to provide certain numbers or certain projections of the number of those who are right now Hispanic population that are essential workers. What are the conditions that they are living? What are exactly the professions, what exactly the jobs that they are performing, and what are the difficulties that they are experiencing? both in healthcare and in their jobs and in their lives, how they work, how they live, what are the conditions that they are being experiencing, how this is affecting their health, in exactly which activities they are participating, and what are the tragic conditions that they have to go through right now because they have to work and they cannot just stay at home, and they cannot also have access to healthcare services, right? And so this is going to be a small project that will be conducted in a year, but that will give us some understanding of what is happening, who is who, and how also this project involves some policies or some recommendations of what to do. This vulnerable population, we believe, because of nationality, because of the conditions, because of the low salaries, and because of the lack of access to public health care, these are the groups that are going to be suffering the most. And we have been seeing this because of the fact that you need to work, you need to be providing for the rest of the economy in different sectors, right? Healthcare, cleaning restaurants, providing healthcare in many ways, aiding, and you have to work. You are not authorized to work, but you are able to work because somebody's providing you with a job, but with low salaries and without access to healthcare. So we're going to try to make this more formal, and this is an important issue. There's another aspect that I am very interested right now in analyzing, which has to do with the border. I'm a border scholar, and I have been, I lived at the border for 8 years, and I've been doing research till today. Focused at the border, and I'm very interested in the jobs at the maquiladora sector. So there are three subjects, right? One is the transmigration, the population that comes from the south, from south of the border, from Mexico, from the Northern Triangle, and from other countries. We have seen that in the past year, more and more people from the African continent, Southeast Asia, have been trying to enter, and some of them are entering with the help of migrant smugglers. I'm going to be performing essential activities in the United States. There are other essential workers that work on the other side of the border at the maquilas, the maquiladora sector in Mexico, and they also the conditions with COVID-19 have been affecting a big amount of people, but they need to continue working under USMCA, the treaty that changed the name after the North American Free Trade Agreement. And the conditions at the maquiladoras, at the condition of these workers, have put them at very high risk. And this is going to be inside or in the context of the new sign and that came into force in July 1st of this year. So these are all aspects that are connected, and the conditions that the workers have been put in this new situation are very concerning. And this is not just a human issue, but this issue has a lot of implications because we are talking about essential workers that provide for the rest of American people, but at the same time are put in a very complex position because of the pandemic, and this is going to be a matter of public health for the whole population if there are no actions that are implemented to try to avoid or protect and provide public health care to this population. So these are three aspects that we need to be considering, not just immigration and what we will be discussing in this panel. We would also have to take into account that there are people waiting at the border, waiting for their asylum cases to continue. Right now, this is closed. The borders are temporarily closed, but smuggling operations are not stopping. And I understand from the research that I've been doing that specifically 2 months, the business have been continuing, and there are people that have been put in these conditions, unauthorized workers in the United States that are coming at the border. And also we need to understand, we need to consider that essential workers live beyond borders, and those who are working for the maquilas to help in the processes of industrialization and that form part of the supply chains that give access to to a lot of what we can consume and we can utilize is very important. So I just wanted to put that on the table, and I would like to have a conversation with all of you, because this subject is very, very complex and does not only involves those who are here unauthorized and have very difficult conditions as healthcare, in the healthcare aspect, or also the crisis, the economic crisis that is taking place right now and will going to be extended, is going to cause a very important problem and maybe fight. Undocumented or unauthorized workers in essential activities don't also have, many of them don't have access to the CARES Act, which is the support that, because of the pandemic, and they will not get access to any type of support. And that is not going to only affect them that are continue working, but it's going to affect the whole population. And also the deaths that are taking place right now among those who work at the maquilas and those who work in the field in the United States. There are undocumented or unauthorized workers that are the ones that are picking up the fruit or processing the food that we all have access to and are right now dying, of course, because of bad conditions of the pandemic, our conditions and circumstances that we need to understand much better. And at this time, because of the stop of our activities, because of our need to stay at home, we have not been able to do field research and to understand exactly well what is happening. So I'm going to put that on the table, these three subjects that we can discuss in the coming segment of questions and answers. Thank you very much for your attention.
Thank you, Guadalupe. Juliet, why don't you give us your overview?
Sure, and thanks for having me. It's great to be with all of you. I work at the Migration Policy Institute, or MPI, in Washington, D.C. We're a nonprofit, nonpartisan think tank that focuses on building research and evidence and data on immigration in the United States and also worldwide. Our goal is to provide information that can guide good policy making for the better management of immigration. Like a lot of organizations, as the COVID-19 crisis hit, we really changed our research agenda and started focusing on the impact of this crisis. And one of the things that we looked at is how immigrant workers fit into this new COVID economy, both the industries that are now deemed essential and those industries that are really hard hit by the recession that's been brought by the COVID-19 response. So this graph, or this table, sorry, is just showing some of those industries where immigrant workers are playing a really big role in the essential jobs. David described some of the work that immigrant workers are filling in the healthcare and social services industries. In addition to that, we see that immigrant workers are filling a broad range of roles. So it's not just the high-skilled workers and middle-skilled workers, it's also, you know, the janitors and cleaners that are cleaning hospital rooms between patients, who are cleaning schools as they start to reopen, and apartment buildings in our cities. Immigrants are also playing a really big role, as you can see, in some of the industries related to our food production. So one of the things that cannot stop during a crisis, even when, you know, the most of us were staying home, is the growing harvesting, transportation, and selling of food and also of medicine. And immigrants are playing a really big role in a lot of these industries, as well as in transportation of all sorts of goods across the country and the transportation within cities of essential workers, other essential workers, to get to their jobs. Just to give some more statistics, and these also come from the American Community Survey, which is a nationally representative survey run by the Census Bureau. Overall, immigrants were, before the pandemic, 17% of the overall workforce, but made up roughly half of general agricultural workers. There were about 2 in 5 food processing workers, about 1 in 5 meat processing workers and butchers. And in some states, this is an even bigger share. So in California, immigrants are over 2/3 of all agricultural workers. In Nebraska, where some of our state comes from, immigrant workers are over 2/3 of meat processing workers, and the same, over 2/3 of seafood industry workers in Alaska. Immigrant workers, like US-born workers who are filling these essential jobs, are working at great personal risk, and Guadalupe hinted at this or discussed this a bit. The job conditions at some essential jobs are just very ripe for the spread of the coronavirus. For example, in meat processing plants, workers are typically working shoulder to shoulder, eating together in crowded cafeterias. and sometimes yelling over the sounds of their work in order to communicate with each other. You may all have heard about a big outbreak of COVID-19 that happened at a Smithfield pork processing plant in South Dakota back in March. After some employees tested positive, the plant remained open, and eventually over 1,000 COVID-19 cases were linked back to that one plant. There's also a Tyson's plant in Waterloo, Iowa that also has had over 1,000 cases linked to it. Due to this, meat processing plants started to close in some places in order to stop the spread and have a chance to kind of restart their operations, let people stay home and clean. But of course, in April, President Trump used the Defense Production Act to order the plants to reopen. So plants are now back open. They're increasingly putting in place more spacing and protective equipment and plastic shields and things like that. But at the same time, we've seen that meat processing plants have driven outbreaks of COVID-19 in small communities all across the United States, including some communities that have small hospitals and are not prepared to deal with these kinds of outbreaks. Another industry where a lot of immigrant essential workers are located is in farm working in the fields. And farm workers, especially those who come on the temporary farm worker visa, often live in crowded housing situations. Sometimes they live in housing provided by the growers. That could be like a barracks-like situation, lots of people in one open space where it's nearly impossible or really impossible for people to isolate if they start to experience symptoms. As a result, we've also seen COVID-19 hit farm workers hard. So, but for one example, in Monterey County, California, a researcher found that farm workers have 3 times the per capita rate of COVID-19 as workers in other industries. And as Guadalupe also discussed, these issues can be compounded by immigrant workers' lack of access to sick leave beyond what's now federally mandated. It depends on the size of the employer, whether that's available. And also lack of access to a safety net that would allow people to stay at home and not work if their illness continues for a long time, or if they just find the conditions unsafe at work and want to stay home. That can be very difficult for people who need to put bread on the table. This, of course, has implications not just for immigrant workers, not just essential workers, but for all of us. These outbreaks that can happen at certain essential work locations, in grocery stores, meatpacking plants, in the field, bring the virus to our communities overall and just contribute to the spread of the virus throughout our country. As we've seen so clearly in this pandemic, the health and well-being of essential workers affects the health and well-being of all of us. I look forward to the discussion. Thank you.
Thank you, Julia. And Ken, I'll hand the floor to you.
All right. Well, thank you all for attending today, and thanks to other speakers. Really very interesting discussion today. The area that I focus on is really an interesting one as it relates to immigration and essential health workers, because my primary focus is actually on the uninsured people and the impact that being uninsured has both on the health of those people who are uninsured, as well as on the impact that that has on the healthcare industry. And so, as I always say, you know, we have a moral obligation to take care of the people that are here. So you see in the healthcare industry right now, many people struggling very much to take care of folks on that have COVID, and as well as other diseases. And yet you have people in the United States who don't have health insurance, who actually are kind of hiding in the shadows and not coming out to get the care that they need, which may be contributing to part of the challenges that we have with COVID right now. If we are going to have take care of everybody, as I think most people would agree we should, in fact we have laws that says that, then we should do it in a more efficient kind of way. This is a chart that I just remind people that when you think about who's uninsured, we actually do a pretty good job of insuring people over age 65 in the United States, as well as people under age 18, because the government programs, Medicaid, the CHIP program for kids, Medicare program for seniors, the place where most of the uninsured people are and the place where the most health disparities exist is actually in working age people. And that is very much focused on lower income working age people. And even though, as this chart shows, we've had significant movements in the number of people with insurance since the Affordable Care Act, these numbers actually have since 2017 been rising back up, especially for younger workers. And younger workers are very often immigrant workers, and lower paid immigrant workers is probably the biggest problem. So the uninsured rates and the poor outcomes that come with that don't just vary by age, but they also vary by state and state policy. And so when we look at state policy, Texas, frankly, has more uninsured people and a higher percentage of uninsured people than any state in the country, which means that uninsured population has worse outcomes, has less access to care, and also harms the economic vitality of the healthcare industry. And so even though the number of uninsured people has reduced quite a bit in Texas since the Affordable Care Act, it's still over 5 million people in Texas are uninsured. And we think actually now with COVID, that number is actually closer to 6 million people. About a third of all the working age people in Texas do not have health insurance. And Texas, Houston, Dallas, San Antonio have 3 of the 4 worst big cities in the country in terms of uninsured people. That puts tremendous strain on the healthcare system as well. And so as we continue the discussion today, we'll talk a little bit more about that. Let me leave it with this slide in order for us to get onto the discussion. But the reality is when people don't have health insurance, as many undocumented people don't have health insurance, low paid American citizens, people here on visas that understand the system, it's really a quagmire for those folks. Don't know where to go to get care. They show up at various different places, private physicians, fairly qualified health centers, private hospitals, public hospitals, charity clinics, or frankly in jail. And those providers of that care chase funds in a very inefficient way to pay for those services. And so this actually sort of says why we have to deal with both the existence of low-wage people that do not have health insurance, very many of those being immigrants, and find a more efficient way to provide care for them that's not just when they show up at the emergency room, as often happens right now. I'm going to leave it there, and why don't we go on, Stephen, into commercials? To this, and we might come back to this slide a little bit later. Or do you want me to do that slide real bad, Stephen?
Sure, go ahead.
Well, this is just a quick slide that just sort of shows how Texas compares in health outcomes compared to other states very poorly, as we do in health insurance. And of course, in Texas, where you have nearly 6 million people uninsured now, how you would go about doing that. Texas needs to expand Medicaid. There's a bunch of people eligible for currently for Medicaid that are not enrolled. You do have a real problem with about 800,000 undocumented folks that are not eligible for any government programs. But half of the people who are uninsured actually work primarily for small employers or work multiple part-time jobs and are not eligible for employer-sponsored insurance. So if you really want to get those people access to care earlier in their disease state, help them improve their lives and reduce income or health disparities, we also have to talk about the employer impact of this as well. So I know we're kind of running behind, and so let me, again, like I said, let me just leave it at that, and let's go to the questions. I think that's a good setup for where we're going.
Sounds good. So we have a great foundation for our conversation. I just wanted to kick us off by establishing how do we define what an essential worker is, and why is employment in these essential services so heavily weighted towards immigrant labor?
Well, I guess I can go first. The way I would define an essential worker for purposes of this pandemic is jobs that are still highly in demand during a pandemic or other crisis. And so, when we're talking about this crisis, whether it's in healthcare, these delivery services, IT services, still remain in demand despite the fact that we've had a major economic contraction and a pandemic that makes it difficult to travel or go to in-person activities. Obviously, industries, the opposite, non-essential services would be places like restaurants, bars, gyms and other places where people cannot go as a result of the virus. So we've seen unemployment rise to a unprecedented level in in-person dining, and we have seen almost no increase in the unemployment rate among computer jobs. So a big difference between different outcomes depending on the occupation. And so these services that remain in demand, these are the things that we need to make sure that we preserve from a standpoint of government policy.
As to why we have so many immigrants in these essential services, on the high-skilled end and our doctors and research scientists, I think partly it's by design in our immigration policy. Our employment-based immigration system and our temporary visa systems are really designed to bring in high-skilled workers, kind of the best and the brightest from around the world. And we're lucky as the United States that we're seen as a country of opportunity, and that the best and brightest do want to come here and build their careers here. And we have some of the best universities, some of the best research facilities that people want to join. On the lower skilled end, we just have a really long history of relying on immigrant workers for a lot of service industries, for a lot of the lower wage, less well compensated, more difficult jobs, and especially the farm work jobs that we specifically had the Bracero program with Mexico to bring Mexican workers initially during World War II, but it extended long past to fill those farm worker jobs. And that set up this chain of migration that's really become established in how we have our farms set up and how that labor market works. And it's, these are difficult jobs. The pay is not great. Workers are working in incredibly hot fields, backbreaking work, and often US workers don't want to do that work. And if we, as was said in the video, if we raise the wages of farm worker jobs enough that they would be attractive to US workers who have so many other opportunities, we may lose our food industry. We may just start importing all of our food because we couldn't compete with other countries, especially our neighbor to the south that's so, has such great produce. So I think those are some of the reasons why we are relying on immigrant workers so heavily right now.
And those immigrants are not just in agriculture and hospitality, but also in healthcare as well. And so you see, I think David had a slide earlier that talked about how many home health attendants and personal care attendants are immigrants. These are very low paid, really hard jobs for any of us that have had aging parents and knowing that, that may need help with home health care or work in nursing homes and stuff. These are tough, hard jobs, and many of these are being filled with immigrants right now who themselves struggle with access to health care in a time where we need to make sure that those folks are really very healthy themselves. And so it's really interesting to me that it's not, we haven't seen a lot of the people that have lost their jobs in other industries because of COVID rushing to fill the jobs to be a home health attendant or to work in a nursing home. So that sort of, to me, is today's example of this is not, we're not talking about taking jobs away from Americans. We're talking about jobs that probably most Americans are not interested in having.
Essential workers, I'm just going to add to what all my colleagues said that were very important points. I just want to make a last point about these. Essential workers, essential activities during a pandemic. For example, in these conditions, we need to be at home. There needs to be people working in sectors that are of vital importance and for our lives are vital. And those jobs are complicated to perform under the current circumstances because we need to be inside our homes or performing other types of jobs inside our homes in order to, to avoid contaging others or getting the virus. And these people are, performing the activities for us to have access to food, for us to have access to healthcare, cleaning jobs at hospitals, and many activities that are essential for everybody else. And many of these people are undocumented or unauthorized. There's something important and interesting to consider that was very surprising to me, and I continue repeating, which is the fact that the remittances, the level of remittances in many of the countries, I'm talking about Mexico, in the past few months, the registrations of the number of remittances have been the highest in the past year. So it's important to consider that that even though the United States and the world overall is living an economic crisis because of the pandemic, essential workers, unauthorized, are sending money to their countries of origin to support their families because they are performing jobs in the United States to provide life and to provide food and to provide healthcare and services to many people. So also beyond borders, these workers are essential for lives, not only in the United States, but also for the lives of their families.
So, I'm hearing that even in an era where we have, double-digit unemployment, our economy and our society is still incredibly reliant on this critical foreign-born labor. Before we delve into, some talking specifically about, how that's played out during the pandemic, I wonder if the panel could talk a little bit about how our current immigration system facilitates or impedes our ability to hire the workers, particularly in essential industries, that our economy needs to function and grow.
Our immigration system is really basically designed with a lot of slots and categories for very specific categories and types of people. On the employment side, our permanent employment-based immigration system is really designed to bring high-skilled workers. So we do a good job of bringing those research scientists, to a lesser extent bringing those doctors, bringing those IT professionals that we're relying on a lot right now. On the middle skilled side, all of our immigration that comes to fill those home healthcare aid jobs that you were talking about, Ken, or jobs across our economy, that's generally coming through a family-based immigration system. We don't have employment-based categories by and large for middle skilled or lower skilled workers. On our temporary visa side, we have the farm worker visa program. We also have another, the H-2B visa for non-agricultural temporary workers. Those tend to be summer resort and landscaping and forestry type jobs. So here and there we do okay. We do okay at the high skilled end. We bring in the farm workers, but our immigration system is very constrained. It makes it very difficult for a lot of employers to bring in workers that they could really benefit from and that could support our economy. And I think that's something that, hopefully one day Congress will have the appetite to take on immigration policy again. And I think what we need to think about is how to match our immigration streams with the broad needs all across the skill spectrum and across our economy and better align those categories with where, immigrant workers really are supporting our country's growth.
There are caps on immigration for high-skilled workers. For the H-1B, we're talking about 85,000 workers that are auctioned off in a lottery with 4 times as many applicants as there are slots. They always get filled. Basically, since the Great Recession, they've always been filled in the first week of that they've been made available. This demonstrates that really, we're using a lottery system to decide which skilled employers get to hire which skilled workers, which really does not make sense. This is, just a major constraint on the immigration system's ability to fill a market demand for these types of positions. And so that's the main bottleneck, but then you also have permanent residency, which is after I get a temporary work visa, then I'm trying to transition to permanent residence. And at that stage, we have a backlog of about 1 million people waiting for the opportunity to become permanent residents in this country. The majority of those workers are from India. This is a curious fact about our immigration system, that we allot our green cards based on which countries people come from. And so because the largest number of applicants are from India and their slot is the same as every other country in the world, we have a huge backlog of Indian workers, mainly in tech industries, but many are also physicians and in healthcare industries. And so we have this huge backlog of people waiting to become permanent residents, and ultimately that leads to a pathway to citizenship. And these workers who are applying today or who are at the end of the line will likely never see a green card or permanent residence in the United States as a result of the constraints of the employment-based green card caps. And so for those workers, they're on a temporary work visa. So if they get laid off or if they get sick, that's the end of their time in the United States. They have to leave the country, their families have to leave the country, and that's a major burden to have hanging over your head throughout this period. We've already seen H-1Bs who've died while on an H-1B, and their families lose status because their status is contingent on that worker continuing to fill whatever role the employer brought them in on. And so that's the system that Congress has created. It hasn't updated the system in a major way since 1990. And so we're dealing with a immigration system that's about 3 decades out of date. And now is a great time to have a discussion about how we want to update it.
I would like to add to the.
Sure. Go ahead, Guadalupe.
Oh, sorry. Thank you. I would like to add to the comments that there are 2 labor markets in the United States and for foreign-born population. And we were been talking about visas. And there are visas for those that are in essential activities, but there are another part of the population, and we're talking about the unauthorized or undocumented or documented or unauthorized immigrants in the United States. And this is where the spaces are very open. But this is where there are double standards when talking about immigration in the United States. Because people who come from other countries who don't have access to public health care, who don't have access to all the benefits of a worker that is authorized to work in the United States. But in that regard, many essential workers that are in agriculture, that work in farming, they don't have to have an H-2A, H-2B visa. They just have to work. And we need to consider that the opportunities are there. These people are working for all of us to put food on the table, to be able to get access to good health care, in the construction, in construction, all the essential activities that right now, to fix some infrastructure, we'll still need it. They are there, and not all of them have visas. It's not a problem of visas under this double standard system that we have that has not been fixed with a comprehensive immigration reform, and is going to put all the society at very high risk if this pandemic extends, and in the healthcare effects will be extended as we are observing right now. People don't have access to public health care. They are continue working, but they are getting sick, and they are going to transmit the virus to other people because they have to leave, and they are providing for all of us. So I think this is important to consider, right? What is the access or how people from other countries there is access. And most of these activities that unauthorized workers perform are those jobs that the citizens of this country or authorized workers are not willing to perform. We need to consider that. Thank you.
And just a quick build on what Guadalupe was saying is, you have especially we see is the impact on the healthcare industry, and frankly the impact on how bad the COVID crisis is here in Texas is because you have very many people who are here without documents, or someone in their family is not, even if the individual may be eligible for benefits and stuff, delaying getting care, trying to treat at home. We probably have a higher COVID rate than we actually report in Texas because there are a number of immigrants that we see that may actually be dying at home without ever being diagnosed because they're afraid to get the care, or they wait too long to get the care, and that's not good for the spread of the disease as well, because you have people that are working in jobs, they have to go to work. I think Julia said that earlier, people don't have benefits if they don't go to work. And so, it's a difficult combination of employment practices, immigration, and healthcare to sort of all come together in this current crisis that we need to deal with.
So, I guess we've identified that immigrant essential workers are kind of at the unfortunate nexus of two overarching kind of issues at play. You know, their efforts are critical to our pandemic response, but the immigration system isn't working as well as it should for these immigrants or their employers. As well as, you know, we already know that there are significant health disparities in this country based on race and ethnicity, and most immigrants are ethnic or racial minorities. And then on top of that, by virtue of being an immigrant, there are additional health disparities at play. So I'm wondering, what are some promising policy solutions the panel sees that could identify, that could address these two kind of problems that we've been talking about?
Well, the most important thing we need to do is we need to make legal immigration a lot easier. That would deal with the lower skill, black market, illegal market. That's the reason people immigrate illegally, is because they don't have an opportunity to come legally. That would make the biggest difference in dealing with that issue. At the higher skilled end, you know, we have doctors who are on H-1Bs who are getting sick and losing their jobs and having to become undocumented that direction, or self-deport back to their home country during a pandemic. That's a problem that can be dealt with by giving them green cards and permanent residence. So in both scenarios, the answer is an easier path to legal permanent residence, and easier path to a work visa or to legal status. Either way, we have to deal with the fact that the legal immigration system is broken and antiquated and not reflective of current labor demands in this country. So I think that's the number one thing. There are a lot of other things that you know, go along with that, but I'll leave it to some of the other panelists to go into some more detail about this.
I would like to add to what David said, that it's very, very important. And I mentioned that before. I have done research about those that are coming from other countries in the world and can arrive to the United States. As soon as they cross the checkpoint, they find a job, which is very important. People are not coming or waiting for asylum or waiting for an opportunity to come here or crossing the border with the help of a migrant smuggler just because, you know, they want to get access to free healthcare and free education. No, they have a job. There are jobs here. And exactly what David said, it's because the immigration system is broken. And there is space for everybody who is in the United States working. So it's very important to consider that, to make it, to make it legal, because right now it's a matter of public health. People in essential activities are getting the virus, and they are also becoming, a problem for the whole system. I mean, it's the solution and a problem also. So there needs to be access to public health care to everybody who's working in the United States. We have to understand that this is a matter of public health care, and providing a legal way to work in the United States, because as I said, people are coming because there are incentives. The main reason why people are applying for asylum or people are coming to the United States because of economic motivations and because they are crossing without authorization and working without authorization is because there are jobs. And this is the main issue that explains undocumented or irregular immigration. The pull factors of immigration, which is basically employment. You know, the United States is going to go through a crisis, but there are ways to try to understand how it's going to be the labor markets are going to continue accepting immigrants. So let's legalize them and providing right now possibilities of public health care to everybody who lives in the country. It's in the benefit of the whole country. We need to have food on the table. We need to we are living with the work that they are performing. So it's important to understand that if they are not having access to healthcare, they are going to also form part of all the problem of public healthcare during a pandemic. We need to understand that. Thank you.
The other thing I think that's so interesting to me, especially now that we spend a lot of time talking about flattening the curve and everybody understands about not spreading the disease. Well, there's actually a disease that we need to spread a whole lot, and that disease is knowledge of how the current immigration system actually works. And so I will make a blatant pitch for the Rational Middle video series to everybody on the call today to say, we absolutely need all of our friends and family and everybody else out there to understand the limitations, the way the current system, the failures in it, the problems with it, the fact that it hasn't been updated for 30 or 40 years, all of those issues, because I think one of the big problems is it's very easy to have talking points that, oh, we should shut the borders, or, oh, they're taking American jobs and stuff. And until more people actually understand these issues and know the truth and the facts, then it's going to be much easier for the political class to have a discussion about how do you actually fix the immigration system.
I think that, some things that would help apply as much to U.S. born essential workers as to immigrant essential workers, just to add to what all of my fellow panelists have said. And part of that is workplace safety standards. For lack of federal guidance, states are starting to step up and put into place guidance, but workers who are essential, who need to keep going to work, should be given adequate protection. There should be spacing out of workers. There should be better ventilation. There could be guidelines to try to make these jobs safer and slow the spread within the workplace. Essential workers' inability to not work if they're feeling symptoms, if they're, if they catch COVID-19, if they test positive, if a family member tests positive, it's really essential for people to be able to stay home. There has been some federal help in this regard. Congress did mandate some paid sick leave and family care leave. But if workers, can't find a safe job, that shouldn't disqualify them from unemployment insurance. There should be, safety nets provided. We've just seen the negative impacts of people being excluded from the safety net. So whether, that means temporarily giving more rights to unauthorized immigrants or thinking about a path to legal status for essential workers, it's putting all of us at risk to have people who feel so compelled to go to work, even when it's not safe to do so, even when that's contributing to the spread of COVID-19. And then, as my fellow panelists have mentioned, just making sure that everybody in this country understands where to go to get tested and can have affordable testing, which I think we've seen expand a lot over the past several months, and also feel safe going to see the doctor, especially for unauthorized immigrants. They need to know that there won't be immigration repercussions if they do seek that treatment if needed. And if they do seek out information, resources. So people need to feel safe to get tested, treated, and to stay home when possible, and that will help to slow the spread.
I would just a couple quick builds on that. Julia said it really fast, but I can't overestimate how important it is that people have paid sick leave so they can actually stay home and take care of themselves and not worry that they're going to lose their job, as so many immigrants fear right now. I would also, any friend of mine that are on the Zoom call today would be disappointed if I didn't say the 17 states that haven't expanded Medicaid for low-income adults should absolutely do that, and they should do it today. And there's no reason why the governor couldn't make that announcement this afternoon. And he could call me and I could explain to him how he could do that. And we should really make sure that a lot of low-income folks have access to healthcare that they don't have right now, simply because, unlike California, New York, and Illinois, other major urban centers, we have not expanded Medicaid to a lot of folks that would be eligible for it right now, and therefore be able to get into care and have providers that are paid for it and not have the uncompensated care problems that we have in Texas. I have to always make my pitch. Every presentation has a place for Medicaid expansion.
I would be disappointed if you didn't. I was waiting for it, Jen. So I want to spend the last 15 minutes and turn to, we've got a series of great questions from the audience. So I just want to kick off with Mario Mendoza has a question about the data that we're referring to when we talk about immigrants. About it's his understanding that most of it comes from the U.S. Census Bureau's American Community Survey, and I think he's interested in the panel's perspective on how reliable that data is. And I'll just tack on that question. What kind of data or research gaps currently exist that we need to bridge to better understand the problems faced by foreign-born essential workers and how to better support them?
So the American Community Survey is an annual survey that's run by the U.S. Census Bureau. It's a random sample of people living in the United States, and it's a pretty big sample of Americans. So in between the census, which happens only every 10 years, the ACS is one of the biggest and the best surveys that we have to try to understand what's happening with our population and with various social dynamics, people's poverty status, access to benefits, and things like that. So it's a high quality, well-trusted survey that's a great resource for researchers. In terms of what data we're missing, I have like an endless list of data that I wish were available. But I think, especially, so we at the Migration Policy Institute use a complicated process to try to identify who in the American Community Survey is a legal immigrant and who is an unauthorized immigrant. This is basically a very educated guess through statistical methods that we make. It's, not maybe possible to expect that we would have better data on unauthorized immigrants than that. We do our best, but that's something that's always difficult to know exactly what's happening with populations that don't necessarily want to talk to researchers or feel safe sharing all of their information. And another big data gap, I think, is that we don't know how people came into the country. So when we look at the American Community Survey, we know if people are US citizens or non-citizens, and we know what country they were born in. But we don't know if they came on an H-1B visa. We don't know if they came on a green card, if they came through family ties. And having all of that information somewhere would be just incredibly helpful for guiding our policymaking on immigration policy to see how these different workers were faring in the United States and what their trajectories look like.
I would just add that we know that the American Community Survey is a very reliable survey because it matches very closely to what we see with the decennial census, which is a very comprehensive count of everyone in the United States. It also aligns with separate collection on births in the United States through the CDC. So every birth is recorded in the United States. Everyone has a very, very strong incentive to record their birth as well as record their death. And in both of those cases, the American Community Survey matches the administrative records that we have, as well as the administrative records that we have from the Department of Homeland Security. So there are a variety of different ways in which it's validated, but it is a very, very reliable survey, and these estimates are, should be taken as fact.
I agree with what David and Julia said. However, in this current situation, and connected to what COVID-19 has, what are the conditions of unauthorized population? With regards to the pandemic, with regards to the activities, with regards to their household conditions. This is why it's important to expand over what is right now on the Office of the Census has done. In this case, it's needed additional surveys to understand or to provide responses to certain questions that we will have from here on, right? There are demographic data that has been covered that we understand. We can do great projections about unauthorized population in the United States, but there are particular questions that we cannot answer with the current data. And it has to do with the health, the healthcare or the conditions, the health conditions and economic conditions that that these communities are going to be living in these coming months or years. of great economic deprivation and in this healthcare crisis. So these data have to be complemented by other surveys that need to be done, or semi-structured interviews or other qualitative methodologies to understand the processes or other some dynamics that are not captured by the current data that we have access to.
Great. Our next question is from Amy Gasca. She asks, based on the Mexico, US, and Canada agreement, it was agreed that companies in Mexico will have to demonstrate that labor pay is $16 per hour after 2023. One, are you seeing that companies are preparing to comply? And two, will this planned increase reduce immigration of essential workers, and how will it affect the US economy? Any thoughts?
It's not a topic that I can talk to, so it has to be somebody else on the panel.
Okay. Well, why don't we move on? Pamela Cruz asks, is there or should there be a push for providing emergency or temporary work authorization for undocumented immigrants who are working as essential workers?
Yes.
Yes.
I have a question. Go ahead.
Oh, I was just going to say, this is something certainly that advocates are pushing for, and we've seen that other countries in the world have taken this approach. Portugal has temporarily given everyone basically the same rights as citizenship. I don't think it is citizenship, but giving everybody full rights and access to their healthcare system and to other social benefits. So we've seen this model taken on to recognize the role that essential workers are playing and the role that immigrants are playing as essential workers to extend full rights, and in that way, try to make sure that everybody has access to the safety net, at least temporarily.
I've got a question from Meg Healy. If the panel could imagine a world where we've streamlined the number of visa types and reformed the legal immigration system and the process involved, what benefits would we see? What would the ramifications of these changes be?
Well, we would have a much larger economy than we have right now. We'd see more economic growth. Countries with declining populations, declining working age populations have very slow economic growth. And they really suffer in qualitative ways as well, because they lack in certain lower skill services. The home health care aid industry in the United States is very vibrant compared to some other countries who are now seeking to import these types of workers, Japan being one example. So we would both benefit in terms of greater economic growth, economic prosperity, as well as these qualitative improvements where we have services that would otherwise not be available in the country.
And I think if you take that plus the opportunity to better rationalize the financing of our healthcare system, and there's a number of different ways that we could do that, but no matter what we would focus on a system that reduces the health disparities that we have right now and saves money at the same time. I think everybody, at least everybody that I talk to, believes that spending 18-19% of GDP on healthcare, we could redirect those funds to housing and education and other things that would be much better long-term for the economy than continuing to increase healthcare spending. And yet we don't have good policies that say that there's ways to improve health outcomes and reduce the disparities that we see between immigrant populations and the people that have been here for a longer period of time and their citizens, that we could do that in a way that would actually allow us to redirect some of that economic benefit to things that might have a a better outcome than just spending it on emergency room care and people getting sick and not being taken care of.
Yeah, and I would like to add another element, which is, I think fixing the broken immigration system with a comprehensive reform. And I'm not I'm not using the term comprehensive to go to previous administrations or to bipartisan interesting and important efforts in the past. I'm also talking about the human aspect of this. As I mentioned, if someone wants to work in the United States, they will be able to work on, they arrive to the United States and cross the checkpoint. And we're going to eliminate these migrant smuggling networks that are connected to other illicit activities, such as drug trafficking activities. I've been doing a lot of research about that. If you generate, it's like prohibition, right? You can generate prohibition, you generate debts, you generate mafias, you generate, ways to get access to jobs that are existing in the United States. And you're going to affect the lives of human beings that are going to try to make it through ways that are not legal. If you expand the number of visas and it's connected to the needs of the U.S. economy, we're going to avoid murders. We're going to avoid the formation of mafias and avoiding, these illicit markets, illicit groups that are formed that cause a lot of death and destruction.
I have one last question to take us out. Is there a risk that conducting this conversation about immigration with such a focus on the economic role immigrants play might be counterproductive? So Michael Trevino has a question asking, would it be better or would we approach this issue differently if we call these people human beings instead of foreign-born workers? So I guess, does positioning these individuals in our conversations as first and foremost workers who bring a quantifiable social or economic benefit have an unintended dehumanizing effect?
I would like to answer a little bit of this question. I believe that we all would like conversation to happen that way. Unfortunately, the way that immigration is politicized in the United States, it makes it very difficult to talk about this, beyond the economicism of the subject itself. You see the polarization that exists in the country and the polarization that exists just talking about immigration in the United States. It's impossible. It would be much more beneficial in human and economic terms, in social terms, to talk about these issues and to see the benefits of doing the things the way that need to be done. As I said, we talked about comprehensive immigration reform as a bipartisan effort for several years until today. It's because it helps the whole society of the United States of America, and immigrants make America great. That's for sure. And the problem is politicians and how this has been politicized to serve in bipartisan bad effort. Utilizing these as a way to win elections, and that's a problem. The politicization of the subject itself.
I would say that there's evidence that the focus on economics as a make or break issue for opponents of immigration or proponents is misguided. It is true that people are moved by the people they know more than anything else. And so the rise in popular support for immigration that we've seen over the last 30 years, it's not reflected in the presidential electoral vote in 2016, but there's been a sea change in support for immigration from 1996 to today. In 1996, 2/3 of the American public thought we should restrict immigration. Now it's 2/3 against restriction. Basically, 2020 is the high in Gallup polling data for support for immigration. And so this long-term increase over the last couple of decades has basically demonstrated that the real motivation, the real change for people is knowing other immigrants. And so as immigration has penetrated communities all across the United States, not just California, not just Texas, but every one of the 50 states is now receiving immigrants for the first time. The South throughout its entire history had almost no immigrants. It was, it was slave population and the native white population, but even in the 19th century, they were basically untouched by immigration. Today, they're leading the way in increases in immigration and immigrant population. And so we're seeing changes in attitude there in their cities and in suburbs all across the country that are now having contact with immigrants for the first time, perhaps in their entire history of their families. And that, I think, is driving the change in popular opinion. I think economics is incredibly important. I think it being part of being a human being is in part contributing economically to your society. So I don't think these things are mutually exclusive, but I do think that, we do need to focus on more than just economics when we're trying to talk about this issue. Many people don't know that they know immigrants, that they're dealing with them on a day-to-day basis until, they reveal themselves as, oh, I'm a dreamer, I didn't even know it. So I do think that we should focus more than just economics, but I do think economics is important, and people's role as workers and contributors matters too.
Well, we are at time, so I just want to thank our wonderful panelists for sharing their expertise and insights today, as well as all of our attendees for joining us. We've covered a lot in the past hour and 20 minutes, but I think it's clear that our ability to beat the coronavirus and rejuvenate our economy is going to require the help of immigrants, and there's a myriad of ways that we could better help them. This webcast is part of an ongoing online series the Center is convening on immigration topics. So I'd like you to invite you to join us on September 9th at noon for a discussion between Stan Merrick and Lauren Steffi about Lauren's new book, Deconstructed, An Insider's View of Illegal Immigration and the Buildings Trade. Once again, thank you, and I hope to see you all again soon. Bye.
Thanks, everybody.